Centers for Disease Control in Atlanta today released the results of a study which shows that the lifestyle of some male homosexuals has triggered an epidemic of a rare form of cancer.
A deadly virus was on the loose. It had gone global by the early 1980s. It was called the gay plague, and it was a death sentence at the time, with a 96% fatality rate. This is the story of the epidemic that tore through America, spreading fear and hate. Looking at the responsibility of the government during these dark times and the rights of the victims that were denied. By 1981, mysterious cases of incurable diseases occurred to the point that there were officially diagnosed cases of acquired immunodeficiency syndrome. However, it manifested primarily in young gay men, with the vast majority diagnosed in New York and Los Angeles.
HIV can enter the body through different ways. The most common way is actually sexual transmission.
The term AIDS stands for the acquired immunodeficiency syndrome.
HIV gets into your body, and this particular virus, they can make the immune system go down so that your body is susceptible to really serious infections, viruses, fungal infections, bacterial infections, and without treatment, people prior to us getting HIV treatments, unfortunately, would do very poorly from getting these serious infections.
AIDS came about. It entered a world filled with panic and stigma. These were the undeserving victims of the AIDS crisis.
People with HIV were called dirty, were called vectors, were called all sorts of names. It was just a terrible time for stigma and prejudice.
Gays are being called a dangerous and violent group that corrupts children and infects the community with AIDS.
Even in San Francisco, gay people face some stigma. Not everyone respected them, and not everyone thought that they deserved to be helped. I think that was less the problem in San Francisco than in most other parts of the country. But this was also a new infection, a new type of virus that people didn't know anything about, really.
Without the help of the government, hundreds of thousands more people would have died as a result of AIDS. During this crisis, it was the government's responsibility to provide equal health care for all Americans and work to stop the spread of stigma and AIDS. During the AIDS crisis, protesters worked to bring awareness about how the government was leaving its responsibility to care for the American people in the dust.
The fact that it has taken the president 5 years to begin to even address this problem publicly demonstrates that this administration hasn't given it the level of commitment that it deserved.
Well, I think they should have done what they eventually did, which is devote resources to research in particular, but also to support the availability of drugs once they were developed. That eventually was done by the government. The government considers and did consider AIDS to be a disease requiring access to treatment. So patients with AIDS had a real benefit in terms of the federal response that really saved many lives and kept other people from getting infected. So I think the government eventually did the right thing, but it took them a number of years to really respond adequately.
And do you tell everybody it is okay to hug someone who is HIV positive like me?
I sure do, Cammy.
That makes me very happy.
Give me a hug.
More than 300,000 victims of AIDS died during the AIDS crisis. Many of these victims died just days after arriving at the hospital.
San Francisco General Hospital is a large hospital in the city. The hospital takes care of people regardless of their ability to pay. So it's what we call a safety net hospital. And it has been involved in responding to other epidemics earlier, tuberculosis, polio, back in history. So it was natural enough for San Francisco General Hospital to respond to this virus.
Ward 8 at San Francisco General Hospital was one of the only hospitals that would treat AIDS patients. Though it sounded simple, it was the only hospital where nurses didn't wear gloves to touch patients. At the time, it was revolutionary to have skin-to-skin contact with someone who had contracted AIDS and treat AIDS patients with dignity and respect.
They said this is the #1 disease, but they're not giving any money for it. It's absurd.
The AIDS crisis ultimately came to an end when the federal government decided to take up its responsibility to care for the American people. The government funded research into better understanding HIV and AIDS causes, better prevention techniques, and treatments. The government eventually worked to end the stigma around AIDS and later launched programs to raise awareness on HIV and AIDS prevention. By 1990, nearly 300,000 people had died. This number may have been much lower if governmental intervention came earlier and stronger.
The experience of living through the AIDS epidemic to war. In this city alone, AIDS already has killed more than 5,000 people. That is 3 times the number of people from San Francisco who died fighting in all the wars in this century.
In every story, there is darkness and struggle. The story of the AIDS crisis is no different. During the AIDS crisis, villains ranging from the U.S. president to everyday people spread stigma and hate every day. Many religious and elected leaders picked ignorance over action. But every story also has its heroes and allies: the nurses, the doctors, the friends, the families, and the survivors. They fought for the right to live. They marched, they cried, they died. They supported one another. They fought to bring attention to the deadly epidemic. Their fight brought change to the treatment of AIDS patients. Eventually, the government took responsibility to join the fight against the virus. Many lives were saved because of this fight. Although in the past few decades, the U.S. government has worked to curb the number of AIDS cases, the new administration led by President Donald Trump is moving backwards. The administration is working against public health by defunding scientific research, dismantling organizations like USAID, and withdrawing from the World Health Organization. These actions have not just set back the US, but other nations as well. We should all be united to combat this disease and the danger it poses globally. Like in those early years of the AIDS crisis, again, we need heroes to fight. We must also work to prevent the government from shying away from its responsibility to maintain the health of all its citizens. Now more than ever, we must all join the fight for our rights and humanity.